Hi everybody, Dr. Mandy here. As you can tell, we are not in South Dakota, but we are actually at our other satellite office in Miramar Beach, Florida. So we're out here enjoying the weather, and I wanted to do a video that talks about our hearing aids and overnight fix. But before we do all that, if you want to go onto the subscribe button, you hit the bell at the top of the page and you will get notified every time we post a video if you're watching this on YouTube. So anyways, as far as our hearing aids and overnight fix, it is, hearing aids are a process just like anything else that your brain needs to get used to. And I've seen it way too many times where I think patients come in and they're like, I want to hear better, get me some hearing aids. We order the hearing aids, and then all of a sudden, they're not wearing them. Well, they're not doing what I think they should do. So, if you are have some hearing loss and you're looking into hearing aids, I just wanted to discuss some of the factors that can make it much easier to get through the journey of hearing aids and hearing loss, because hearing aids really are a good thing when it comes to hearing loss to improve your quality of life. It's an easy thing to do, but to go into it, getting all the information is going to make you that much more successful when you are using them and getting used to them. So you have to think about your hearing loss. So for the majority of us, our hearing loss was gradual over time. So if you think about it, our hearing loss was slowly and slowly and slowly, and as we slowly decrease in our hearing, we, for whatever reason, age, noise, over time, our body adapts, our brain adapts. So then all of a sudden you fix it within a few minutes acoustically with hearing aid. The brain has to remember all this stuff, and it has to reorganize it, and it has to, what is this and what am I doing, and just understanding your hearing loss and what you should be hearing and what you shouldn't be hearing, etc. So it kind of goes back to, I don't know if any of you have been in the office lately. I'm going to give you an example. I cut my thumb, and I actually cut the tendon, and I had to get surgery and get the tendon repaired. So right now I am doing basically occupational therapy to try to get my tendon to stretch and do what it used to do. So this tendon does what it's supposed to do. This tendon is working on it. So for me to have the expectation that my tendon, when the pin came out, was going to bend just like my other thumb was unrealistic. So when I went into occupational therapy, I have a goal of where I want my range of motion to be, but I also understand the realistic expectations and how long it might take to get to that goal. It's the same thing with hearing aids. We have a goal, but we know it might take a little work, a little effort, and just knowing what the expectations are to get to the end result. And the end result will obviously improve our quality of life. And by the way, you probably don't even realize how much you use your thumb, but you really need it if you ever injure it. So anyways, if you have any more questions or you want to talk further about hearing loss and hearing aids and the journey, you can call our office at 605-306-3050, or you can send us a Facebook message. We're also on Instagram and TikTok. Have a great day. Thanks.
We are here to help. If you want to chat with Dr. Mandy, go to Sioux Falls Audiology Associates.com.